areas of responsibility. They also have an agreed upon USAR marking and signaling system, where teams leave a mark or a code after they've assessed a building so that another team doesn't repeat work already done. On the screen is an example of an early map identifying neighborhoods where each search and rescue team would work. It's not fancy. It doesn't have to be fancy sometimes. It just needs to show where you go, where you need to be. Yeah? Sometimes we get stuck in the most high-tech things, and when you don't have all that at your hand, you have to be easy. You have to be quick. Our teams deploy GIS specialists to rapidly create maps and analysis to help coordination and planning to understand the impact and scale of the disaster. In addition to search and rescue teams, international, national, and local aid organizations mobilize to support communities alongside the government. Volunteers from other areas, volunteers from the communities themselves. Information and communication needs of these actors are quite different from the search and rescue teams. UNDAC teams immediately established 4 on-site operation coordination centers across the most affected areas. These served as a center point for the flow of information for first responders, enabling us to maximize both human and in-kind resources coming to assist. The colleagues in the coordination centers worked around the clock to ensure information flows were credible, relevant, and timely. Sorry, I'll go back to my colleague, Nabil. This is a photo working in a tent in the middle of the night, right? We're all familiar with this. This isn't anything unusual, but it's good to point out. Information doesn't take a break. It's always needed, and we need to be ready to always assist as needed. We produced maps of affected areas, maps showing locations where organizations had reached, and more importantly, where they had not. We coordinated teams to conduct multi-sectoral assessments to help identify what and where the urgent needs were. We tracked and mapped field visits carried out by organizations to avoid duplication. In these on-site coordination centers, we provided a place to work, a place to meet and exchange. We provided internet connectivity, and of course, much-needed tea and coffee. We wrote and continue to write situation reports summarizing needs and response in English and Turkish to disseminate information to audiences outside affected areas. On the 16th of February, the international community issued a flash appeal requesting $1 billion to enable humanitarian partners to complement and support the government-led response. The plan aims to assist 5 million people over a three-month period. As of today, the appeal has mobilized $294 million from 18 countries, and 2.4 million people have received some sort of assistance. We continue to work with organizations and government authorities to monitor the response, gathering and sharing information on what has been delivered and where, identifying gaps and passing this information along to responders, government officials, the media, the public themselves. Accountability to affected populations. We can't just do what we're doing and hold on to the information. We need to tell them what we're doing. We need to tell them what we're not doing. We need to communicate. Tailored information was also provided to the Turkish Enterprise and Business Confederation, a local partner network of OCHA and UNDP's Global Connecting Business Initiative. This helped channel their generosity and resources to the most urgent priorities. In-kind donations worth over $11 million were quickly mobilized, including 176 trucks delivering food and relief supplies, generators, and heaters. Private sector wanted to help. They needed to know the best way to do that. That's information. Yeah? They needed the information. What's the best way to get there? Offers of assistance arrive in the first minutes of a disaster, but knowing how to channel them, what's needed, what's not needed, what to say yes to, what to say no to, yeah? Where it should go. That's the role of information and communication. Now, bringing us back to the third and possibly most important group of decision makers that I referred to above, the people who lived through the earthquakes, the people who lost loved ones, schools, homes, livelihoods. Communicating in disasters goes beyond information. How people are communicated with in times of need and despair can have a lifelong impact on the person. In the midst of a crisis, there can be chaos and confusion. Emergency responders, survivors, and others may all be trying to communicate at the same time in every direction. It's crucial that we identify what needs to be communicated, to whom, and through which channels. This can involve setting up channels that are specifically dedicated to emergency communication, such as emergency radio frequencies or social media accounts. It might be printed materials with clear messages in several languages and images posted around town or handed out in flyers. It can be existing messaging systems like the Ministry of Health and WHO's WhatsApp chat that was established during the COVID-19 pandemic. It can be newspapers or television. I remember deploying in 2017 to a small island nation in the Caribbean, home of 100,000 people, where most of the homes were inhabitable because of the hurricane. Power lines were down, cell phone towers had collapsed, radio towers also, radio stations damaged, no communications functioning on site. But people were still listening to radio, so we wondered where they were getting that from. And it was actually a close enough other island nation nearby. So we reached out. We asked if those radio stations on those islands, different countries entirely, would be able to provide airtime, be able to transmit messages so that the people in this country, in the affected country, could hear the messages. Another example, in Myanmar. I was in Myanmar during the COVID-19 pandemic, where everybody was in lockdown. Yeah? And how do you transmit information? Schools are closed. Religious centers are closed. So how do we get that information out? YouTube, Facebook videos. That was the best way of passing information on hand washing. I think we've all seen the TikTok videos out there on how to wash your hands, right? These information channels are important. We need to know what people are receiving, what they have access to so that we can transmit information. All these examples, however, are of one-way communication. Effective communication and community engagement in an emergency requires two-way channels so that aid providers listen to and act on people's needs, suggestions, feedback, and complaints. And people receiving assistance have a say in and lead decisions that affect them. It also prioritizes keeping people in crisis connected with each other and the outside world. The role of communication and community engagement is also important in helping people psychologically cope with disasters. It can promote a sense of safety, calm, connectedness, and hope. Rarely do I find someone who disagrees with this, but we still have a long way to go as governments, donors, humanitarian responders, to truly change the way we work and empower people in crisis to identify and prioritize their needs and design the assistance and protection services they want. This doesn't have to be complicated. It can be hotlines for people to call. For the earthquake here in Turkey, there are now 27 hotlines that people can call to share their experiences, share their needs, share their complaints, ask their questions. The information is collected and consolidated by a small team, but then you have to act on it. Yeah? It's shared back with humanitarian partners to act upon. We can't just receive the information, we have to have a plan to use it. It can be establishing community-based focal points in each relocation settlement, combined with group consultations during distributions to collect issues, to share updates, and to cascade information. It means taking the time to regularly consult women and women's organizations to better understand their needs and inform response plans accordingly. This is already happening in Turkey, but we can further scale it up. So what can we learn from these recent experiences? Communications in emergencies requires a sound understanding of community, its languages, culture, economic conditions, social networks, media, political and power structures, norms and values, demographic trends, and history. We must pay additional attention to whether particular groups, such as women, children, persons with disabilities, older people, or minority language speakers, we need to understand whether they face specific challenges in accessing and providing information. Another lesson, needs assessments tend to focus on items like food, water, shelter, but don't always assess information needs and communication preferences. It's important that these are included in early assessments to inform how community engagement will be undertaken. They should also be included in later on assessments and discussions that follow. Information needs and communication preferences can vary over time. In the immediate aftermath of an earthquake, people might want information on finding missing loved ones, how to access aid, whether they could enter a damaged building, and what to do with bodies recovered. But later, they tend to want information on replacing lost documentation, such as IDs or property deeds, on compensation rights, on death certificates and other legal issues. They want to know when schools will reopen or why a neighbor received assistance and they didn't. There is a range of different ways by which people prefer to communicate and access information. From radio, newspaper, or television, to word of mouth, participatory theater, leaflets, or town hall meetings with community leaders. Preferences vary depending on factors such as mother tongue, literacy level, age, ethnic group, and you can go on. And preferences can change over time, particularly when usual channels are disrupted. The more we know about how people receive, share, and trust information, and anticipate how this may change, the better we will be able to engage with people. To summarize, credible, relevant, and timely information can be as life-saving as food, water, shelter in a disaster. For this, however, we need transparency and information sharing from all sides. Information is too easily siloed and kept too closely held. It's power, right? Incomplete information and misinformation waste time and resources, create gaps. Disinformation is even more dangerous. All kinds of decision makers need information in crisis, credible information, relevant information, timely information. It's used for the highest levels of decision making in government. It can tell rescuers where to focus their precious time in the first days, or what assistance is most needed in the weeks to follow, and for whom. But most importantly, it can empower people affected by the disaster to take informed decisions on their lives, restoring humanity and dignity that is often lost with homes, belongings, and loved ones in a disaster. Thank you very much.
Shelley Cheatham, thank you so much. Really, thank you for your service and your team's service